This is Cynthia Moorhead from University of Hartford, and I am presenting an evidence-based intervention proposal related to breastfeeding promotion during the prenatal period. The World Health Organization recommends initiating exclusive breastfeeding within an hour after birth and through 6 months of age. As we know, breastfeeding provides many health benefits for infants and parents, especially if breastfeeding continues exclusively for 6 months, meaning no other foods or liquids are given, including water. The American College of Obstetricians and Gynecologists report that breastfeeding is associated with a decreased risk of breast cancer, diabetes mellitus, and hypertensive heart disease. Knowing the benefits of breastfeeding is important, but knowing how to promote and support mothers about breastfeeding is crucial. Comprehensive prenatal education on infant feeding is recommended by many United States health organizations because of the need to maximize maternal preparedness for managing lactation barriers. Although 82.5% of United States mothers initiate breastfeeding, only 25% of United States infants exclusively receive their mother's milk for the recommended 6 months. Mothers cite the lack of adequate preparation as the main reason for supplementing during postpartum hospitalization. Evidence suggests that many health professionals have a low level of confidence, clinical competence, knowledge, awareness, and practice towards breastfeeding are not evidence-based, and that they rely on their experiences rather than evidence. Also, education for health professionals about breastfeeding is inconsistent. So my PIO question to begin the search to review literature is as follows. For nurses in a home visitation intervention program, how does an educational episode on evidence-based breastfeeding guidelines affect knowledge and awareness to provide breastfeeding promotion for pregnant women? These were the databases used for the search, the criteria, and keywords. Literature found both qualitative and quantitative studies with nurses or health professionals as participants. Ceylan interviewed maternity nurses to explore the barriers in early initiation of breastfeeding, meaning within the first hour after birth. It resulted in 4 main themes. Delivery, which included the perception of insufficient milk. The theme of culture included traditional practices. The theme of hospital environment involved lack of privacy and chaos. And the last theme was healthcare staff. Some of the participants indicated that they didn't have enough knowledge. The study concluded that support and counseling given in the early postpartum period is important for the initiation of breastfeeding, but to eliminate the barriers in the process, it is recommended that prenatal education is important in overcoming obstacles, and to increase the competence of healthcare staff by having regular training and improve healthcare policy. Both of the other quantitative studies here examine the effect of educational workshops using a pre- and post-test design, resulting in improved knowledge and better outcomes to ensure breastfeeding promotion. These 2 quantitative studies include prenatal mothers as subjects. Perry's study examined the effect of a curriculum to counsel prenatal mothers about breastfeeding and resulted in a possible way of increasing breastfeeding initiation. Rose and Carroll's study examined breastfeeding outcomes after prenatal breastfeeding promotion intervention, including referrals to WIC peer counselors, and the results showed that providers who provided breastfeeding counseling and referral to peer counselors were associated with higher breastfeeding intention. The population for this implementation plan is 7 nurse-family partnership nurses in a home visitation program. Their experience as an NFP nurse ranges from 6 months to 11 years. All 7 nurses have received training and certification as breastfeeding counselors. Nurses carry a caseload of 25 and up to 30 first-time mothers, enrolled prenatally, and partner with them until their child turns 2. Nurses provide home visits every 1 to 2 weeks. The setting for the implementation plan will be at the office building where the team meetings are held, However, the setting can also be virtual using the Zoom platform. The Likert Scale survey will be sent to 7 nurses on June 6th via Google Forms link. They will have 2 weeks to complete before the educational session on June 20th. The educational session will include a review of how to address barriers encountered with breastfeeding, for instance, milk supply, hand expression, and use of pump. The educational session will also include how to begin the conversation about feeding choices using motivational interviewing skills and open-ended questions. Lastly, the educational session will review a teaching checklist nurses will use for breastfeeding promotion, and WIC peer counselors will be invited to the session to meet the nurses, provide information about their support role, contact information, and the referral process. The post-survey will be sent to nurses after the session. They will have 3 weeks to complete by July 11th, when the findings will be analyzed. On August 15th, at the team meeting, plans to disseminate the findings will be completed. To guide the implementation of the EBI project, the Iowa model for evidence-based practice change will be utilized. Following the 6-step process, this model is appropriate because it integrates principles of quality improvement as well as evidence-based strategies to promote the adoption of a new practice. To ensure sustainability, support from the stakeholders is needed. These include the organization, management, the nurses, WIC staff and peer counselors, and breastfeeding task force and our breastfeeding champions. Also, we should integrate change guidelines into policy and procedures. And it's also important to have regular check-ins with the nurses. This can be done at least quarterly during team meetings, to stoke discussions, or during weekly one-on-one clinical supervision meetings. To measure nurses' knowledge and awareness toward providing breastfeeding promotion, the outcome will be measured by providing a Likert scale questionnaire before the breastfeeding promotion educational session. The educational session will include evidence-based knowledge related to breastfeeding promotion and the introduction and review of a teaching checklist to help facilitate breastfeeding discussion with prenatal clients throughout their home visits. The questionnaire will be developed using Google Forms, where a link for the survey will be emailed to nurses. Nurses are all certified breastfeeding counselors, so the questionnaire will consist of statements related to their knowledge and comfort level of providing breastfeeding education and promotion, more than their thoughts on the benefits of breastfeeding. A Likert scale survey will be sent again after the educational session, and possibly a subsequent survey may be sent 8 weeks after the utilization of the teaching checklist. The results will be anonymous, but the answers will be compiled on one page. Data from the pre- and post-survey will be compared and evaluated to determine if the education provided an improvement in nurses' knowledge. Because the questionnaires have a Likert scale for each question and statement, the answers can be translated into numerical values. The results from the Google survey provides in an Excel format where both can be compiled to see a difference in scores. Results of the outcome will be shared in one of our weekly meetings set for August 15th. Time will be allocated to facilitate nurse discussion and thoughts of findings. Each question will be presented again and answers reviewed individually. And there will be a potential to share with other NFP home visitation programs at our quarterly meetings. There are many breastfeeding benefits to mother and infant, especially if breastfeeding is done exclusively. However, only 25% of U.S. infants are breastfed exclusively. Providing nurses with education and teaching guidelines on breastfeeding promotion for prenatal women can increase nurses' knowledge and awareness. Al Noemi says it best: improving health professionals' knowledge, attitudes, and practices towards breastfeeding is considered a key strategy to influence mothers' decision to breastfeed and improve overall rates of breastfeeding. Here are my references, and thank you for listening.